and let us serve to change lives. I mean, for the incoming president's introduction, over to Sri Lakshmi.
Good evening. Many of us, in fact, most of us here, would be familiar with the term Doctors Without Borders. The word is an English translation of a French word, which I shall not even attempt to pronounce. Now, why is this even relevant? Well, our club president's contribution to medical tourism in the state, the prestigious Vijayashri Award in 2004, and the honor bestowed upon him in 2018 by the Indian Institute of Management, Kozhikode, gives us a new perspective, patience without borders. His motto, I love my heart, let it beat. I love my lung, let it breathe. Born to Jamila Yusuf and O.S. Yusuf, his childhood was spent across the multiple cities of Mumbai, Kolkata, and Kochi. Shyam, can you please share the screen? He specialized in cardiothoracic surgery at the Kasturba Medical College, Manipal, after his master's in surgery from the Jawaharlal Nehru Medical College, Aligarh. With advanced training in the United Kingdom, he telescoped his skills to the Fatima Hospital, Calicut, where he performed a bypass surgery, the first of its kind in Malabar. Cardiac centers soon mushroomed all over the city. The cry and the cough of the lungs were drowned. Thoracic surgery took a backseat. Our doctor's response to the crisis was to pioneer keyhole surgery in the chest. His hallmark surgeries include operating on a critically ill 5-day-old baby with pus in the heart, as also a 105-year-old man with a burst lung and removal of a 2.5 kg tumor from the chest, reported as one of the largest tumors ever. He was invited to perform the first live workshop in India on thoracoscopy at the National Conference in 2010. He was the organizing chairman for the national workshops in chest for 2 successive years, 2019 and 20, a record in itself. The Tuberculosis Association of India, established in 1939, deemed it fit to award him the prestigious TAI Award for the year 2020. A past president of Calicut Cardiology Club, he has many publications in scientific journals to his name and continues to give lectures at various platforms. He multitasks as an associate professor and adjunct faculty in Manipal University. He's a consultant doctor in chest and PVS hospitals, Calicut, Sunrise Hospitals, and the Kerala Institute of Medical Sciences, Kochi. His crowning glory would definitely be his successful surgery amidst this raging pandemic in April 2020 on a patient with lung complications of COVID, reportedly the first such surgery in India. Now, if that was not all, he finds the time and leisure to stretch his interests beyond his professional realm to social organizations, Freemasonry, Roundtable, MES, MSS, and CSCO, and yes, of course, the Rotary International. His commitment to service goes way back to the 90s and is highlighted by his contribution in the treatment and rehabilitation of victims of the Chernobyl nuclear disaster. Now, as with all Rotarians, he is also happily married. His significant other, Nargis, is an active member of the Inner Wheel. Their family is complete with Dr. Nihal, Dr. Samreen, and architect Minas. It's a privilege to present the 72nd President of the Rotary Club of Calicut, Dr. Nasir Yusuf. Thank you.
Thank you, Sri Lakshmi. Over to you, Nasir, please.
I have now the honest task of the acceptance speech. This speech, I intend to keep it short, like a mini skirt. Covers all the essentials, but catches your attention. A couple of weeks back, on a particular evening at Malabar Hotel in Kochi. In the lounge, I met my friend, Rotarian Algiers Khalid from Rotary Calicut. And as expected, invariably, the topic broached was Rotary and the impending presidentship. Without batting an eyelid, he said, Doug Vincent is your man. Thank you, Doug, for being here with us this evening. The district governor, Rajesh Subhash, whom I've been associated for many years as a professional working in the hospital, the same hospital, PVS Hospital in Calicut, I've seen him grow phenomenally and to become the district governor. The various PDGs, distinguished guests, Rotarians, Rotarians, and my dear friends. I would like to thank the entire body of Rotary Club Calicut for choosing me as president. I'm humbled that you would place your faith and trust in me. I accept it with a full and grateful heart, and with only one obligation: to devote every effort of my body, my mind, and my spirit to continue to lead our club to greatness and glory. We have always maintained the highest decorum and order within the club. Thanks to our charming and witty past president, Dr. Vishwanath, the quiet and efficient secretary who has laid down office, Mr. Mohammad Ali PP, and the meticulous treasurer, Mr. Bipin Parekh. In recent times, we have been shaken by the tragic pandemic. However, it can be a year of inspiration and hope, and it will be a year of concern, of quiet and sober reassessment of our club's character and purpose. There is a new mood prevailing, reflected by our youthful secretary, Eugene Johnson, and the ever-reliable treasurer, my mentor, Rotarian past president, Mr. Milan Shah. Slide sharing, please, Shyam, for the projects. We have a few projects in the pipeline in tune with the district priorities, which I'm sure our district governor, Dr. Rajesh Subhash, will elaborate. Slide sharing, please. Thank you.
It is shared.
Thank you. The district priorities are restore mother health, green the red, true learning, lend a hand, immunize to maximize, healthy Rotarians, donate to serve. District governor, we shall formulate our projects keeping this in mind. What is core to us in our Rotary is the glass bottle bank. As you all know, there's a lot of litter in our city. There's a lot of beverages, and we know why. And unfortunately, they leave a poor image of our city of Calicut Corporation. Next is what has been dear to our heart in Rotary, the Heart to Heart program, which was pioneered, organized by Dr. Kunyali. Slide, please. This is a novel treatment of patients who have ischemic heart disease, or in simple terms, who have suffered myocardial infarction without any invasive, may it be angioplasties or surgery. And finally, which is dear to my heart and lungs, we are ravaged, and tsunami and COVID can be likened and are similar. Tsunami hits the coast and leaves within a couple of days, leaving behind a trail of destruction, loss of livelihood, and loss of lives. Similarly, COVID enters the body, harbors there for 2 weeks, gone in a couple of weeks, but again leaves massive devastation in the body, particularly to the lungs. The COVID would have left the body, but it will leave the patient in certain cases as a respiratory cripple. We have found over the past year that in certain group of patients who have pus on the chest, who are coughing blood, or localized infection, and a few other conditions, can benefit from surgery. So we intend to target and help these patients who are already drained of their wealth, money, and alleviate and relieve their suffering by extending the helping hand. Further, we intend to work closely with Inner Wheel, of which President Mrs. Lavina Ramesh is here, have joint meetings with Rotary Club of Calicut, Cyber City, as both our clubs have our meetings on the same day every week, that's on Wednesdays, and execute joint projects with Rotary Calicut Midtown. I want to continue hearing your ideas, getting your feedback, and finding out more ways so that we can better serve the society. Let us together, with continued kindness for others less fortunate than us, and let us with renewed courage combat the coming times. Jai Rotary.